This is my first video of the pharmacology series I will be doing on my new channel. So basically, this series is based off of Roach's book, which, if you didn't know, is one of the two books you should be studying for pharmacology. I'll be linking all the resources in the bio and the description. But this isn't just for pharmacology. You can do this for any sort of pharmacology in general, like like the PTCB. But yeah, this is antibiotics is one of the first few chapters in Roach's book, so we'll be getting into that. First, the drug classes. So I'll be going over each of the drug classes as the video goes on, so we can just skip this slide for. Okay, penicillins. So this is probably the most common type of drug in antibiotics. As you can tell by the mechanism of action, it is a cell wall inhibitor because it inhibits the cell wall synthesis, which basically means that it uses the beta-lactam ring to destroy the bacteria cell wall, which in the end kills the bacteria and gets rid of your bacterial infection. So you should know this, that it is bactericidal and that it uses the beta-lactam ring to kill the cell wall. That's what you should really be knowing for the test. And you should also know the prefixes and suffixes for these type of vocabulary. See how it says penicillin G, penicillin V, ampicillin, amoxicillin, axicillin. You see a little pattern? Yeah, there's dash. Okay, so these are the two prefixes you should be knowing for penicillins, dash, cillin, and penny. Every time you see this name in a drug, you should instantly think that it is a penicillin. That's all you really have to know for penicillins. Now let's go on to the next one. Okay, the next one is cephalosporins, which is, oh shoot, my microphone is really lagging today. Sorry about that. Anyways, the next one is cephalosporins, which is a antibiotic, and it is ranked in generations, first gen to fifth gen or fourth gen. Either one is fine. But basically, it works just like penicillins. It uses the beta lactam ring to kill the bacteria. And because of this close similarity, if you have a penicillin allergy, you might have a cephalosporin allergy as well because they work so similarly. Vice versa. If you have a cephalosporin allergy, you will most likely have a penicillin allergy. Yeah, we see this right here, cross reactivity with penicillin, which is why you have to check the allergy history carefully because lots of people skip over this small error, which can lead to bigger errors. Again, avoid alcohol. Um, yeah. Another one you should know for adverse reaction is Stevens-Johnson syndrome. This is a rare adverse reaction, but basically Stevens-Johnson syndrome is like you get these red dots all over you and blisters, and it hurts. You look very red. And that's all you really have to know for cephalosporins, that it works just like penicillins, and that an adverse reaction is Stevens-Johnson syndrome. Third, macrolides. This is different from cephalosporins and penicillins in the fact that it isn't bactericidal, which means that it doesn't kill bacteria, but it just stops it from growing farther. And your white blood cells will, an immune system will kill the bacteria, but this will just stop it from reproducing further. And at high doses, it can be bactericidal, but more times than not, it just stops it from reproducing. It stops the protein synthesis, meaning it stops the bacteria from using its protein to synthesize and reproduce. It binds to this when it synthesizes. And because penicillin allergy patients can't use cephalosporins, they more times than not use macrolides. And that's all you really have to know for the mechanism of action. Again, if you look at the common drugs, they all have the thromycin suffix, meaning that thromycin is the suffix you should be looking for when you're dealing with macrolides. And yeah, that's really all you have to know for the test. This can also be helpful, but it's not high priority right now. Okay, tetracyclines is one of my favorites if you ask me. But basically, it's also bacteriostatic, like macrolides, in the fact that it doesn't kill the bacteria, but just stops it from reproducing further. It also uses protein synthesis. And if you look at the common drugs, it's dash slime, cysline, and showing that tetracyclines have dash cysline at the end of their name. This one doesn't have any severe adverse reactions, which is why I didn't keep it on here. But a major thing you have to look for when you're dealing with tetracyclines is that if there's a child under 8 years old, it can cause tooth decoloration. I like to think T for tooth. Get it? Get it? Get it? Okay. T for teeth, decoloration. That's what you should be looking for. Another big one. Avoid dairy and yeah, avoid dairy in general. Because that can lead to some severe adverse reactions. Aminoglycosides. Now, this one is bactericidal, like penicillins and cephalosporins, and it messes with the DNA of the bacteria. Yeah. And a common drug is gentamicin. This is a big one you have to probably memorize. And look, it's mycin. So basically the prefixes are mycin slash sin. Sorry for the bad handwriting. And this is not to be confused with the macrolide, which is thromycin. Don't get these confused because they're very different drugs. So keep that in mind. Macrolides are thromycin, and aminoglycerides are just mycin. Oh, and a big one for this is nephrotoxicity and autotoxicity. And autotoxicity, both of these toxicities basically are common with aminoglycerides, and this is the main part that you should be looking out for when you hear aminoglycerides or mycin and sin. Autotoxicity is basically toxicity in the ears, so hearing loss, um, ring, ringing in the ears. That's what tinnitus is, and dizziness. Nephrotoxicity is liver tox. Wait, yeah, okay. So nephrotoxicity is liver toxicity, and that's really all you have to know. Aminoglycerides are kidney and ear toxicity. Okay, fluoroquinolones is another big one. It's bactericidal like penicillins, and it messes with the DNA like aminoglycerides. Um, this one is dash fluoraxin. It's just fluoro, like fluoroquine. It's fluoraxin. So yeah, that's the what is it? Prefix or suffix for fluoroquines. And the big one with fluoroquines is that it can cause tendon rupture, especially with the elder people. So tendon rupture is the big one for this one. Sulfonamides are bacteriostatic and they are sulfa. That's the root word for sulfonamides. And a big adverse reaction is photosensitivity. Your body becomes photosensitive when you're taking this drug. Okay, that's basically it for antibiotics. And remember, this is just an overview of the main stuff, but in reality, you should be just reading the book. Okay, sorry about that. But basically, this is all the key things you have to learn. These are the mechanisms. These are the special considerations. Tetracyclines are heat colorization. Aminoglycerides are toxicities. Macrolides are the um, QT prolongation risk, which basically means heart risk. And yeah, fluoroquine is supposed to be on here, which is tendon rupture. But I know this is a lot and it can be a hard to learn at once, but I know that this is not the greatest video, but I will be linking a review sheet in the bio, and that is basically like the cheat sheet. If you can memorize that, you should be good for any antibiotic question. Again, sorry if this video was bad. This is my first one. If you guys have any tips or tricks, leave it in the comments. Again, thank you.